Good afternoon, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve,
And I'm Scott.
and together we are Backyard Musings, the Science and Technology channel. And we hope that you made it through that last segment all the way to the end.
Yeah. Okay, so this is kind of a weird deal here. This is like almost like a magical device that we're going to talk about. Calculator that estimates stuff going on in people's bodies. So it's kind of weird. But
Yeah, a
here we
lot of
go.
people take statins, so I thought this was the producers thought this was a relevant article everybody should know. So here we go.
Okay.
Researchers at the University of Oxford have developed a calculator that estimates a person's individual risk of developing serious muscle disorders from statins, offering a more personalized way to weigh the benefits and risks of these widely used cholesterol-lowering medications. I did not know this was a side effect. I probably should have read the directions. I just throw them in the recycle. The tool is designed to help patients and doctors make better informed decisions about statin treatment, which is commonly used to reduce the risk of heart attacks and strokes. Would you like to know more?
The research published on June 25th of this year in the Lancet Digital Health found that more than 98% of people identified by their GPs, general practitioners, I guess, right,
Yep.
as eligible for statins were predicted to have a low risk of developing serious muscle disorders over the next 10 years. The developing serious muscle, oh, wait a minute, I'm sorry. The finding is notable because concerns about muscle-related side effects remain one of the biggest reasons many people hesitate to start or continue statin therapy.
I haven't even thought about it. And I've been taking statins for over a decade.
Wow.
Huh. The study also uncovered a significant treatment gap. More than 60% of people who qualified for statin treatment were not taking the medication, even though some faced a high risk of heart attack or stroke. Researchers say the new calculator could improve conversations between patients and clinicians by providing a personalized risk estimates instead of relying on general statistics or fears about side effects.
The calculator, available through the Oxford University Innovation Software Store, is based on a clinical prediction model created and validated using anonymized, is that right? Anonymized health records from more than 5.6 million people registered with GP practices across England.
That's a lot of people. Researchers developed the model using data from more than 1.7 million people and then tested its accuracy with another 3.9% million patient records. It's probably AI involved in this. To estimate an individual's risk of serious muscle disorders over 1, 5, and 10 years, the model analyzes 22 routinely collected health factors. These include age, sex, ethnicity, body mass index, smoking status, existing medical conditions, previous muscle problems, vitamin D deficiency, medication use, and statin prescriptions.
The researchers expect the calculator to be used alongside cardiovascular risk tools such as Q-Risk. Not familiar with that. Together, these tools could help patients and clinicians compare the benefits of preventing heart attacks and strokes with the potential risk of serious muscle disorders when deciding whether statin treatment is appropriate.
Statins are among the most commonly prescribed medications for lowering the risk of heart attacks and strokes. However, worries about possible side effects, especially muscle problems, often discourage people from taking them, even when the potential health benefits are substantial. The researchers say the new calculator can help replace those concerns into better perspective by providing individualized estimates of risk.
Importantly, the study focused only on serious muscle disorders that resulted in hospital admission or death.
Wow.
Yeah, it did not examine common muscle aches and pains, which are generally much less severe. Previous research has shown that many mild muscle symptoms reported while taking statins were not actually caused by the medications and should not prevent people from beginning treatment. Although serious muscle disorders are rare, understanding a person's individual level of risk remains an important part of balancing the potential benefits and harms of statin therapy.
Dr. Ting Kai not making that name up, research fellow in the Newfield Department of Primary Care Health Sciences, University of Oxford, and lead off the study said, quote, serious muscle disorders are one of the most widely discussed concerns about statins, but our findings suggest that the risk is very low for the vast majority of people who may benefit from treatment. Understanding a person's risk can help put those concerns into perspective, support more informed treatment decisions, and provide reassurance. For the small number of people at higher risk, it gives clinicians a clear basis for discussing, monitoring, checks, or alternative treatment options.
Professor James Shepherd, professor of primary care research at the University of Oxford, and a senior author of the study said, treatment decisions are often based on estimates of a person's future cardiovascular risk, but much less information is available about their individual risk of adverse outcomes. This research helps address that gap by providing a way to estimate a person's risk of serious muscle disorders alongside their cardiovascular risk. Bringing those two pieces of information together could support more personalized and better informed decisions about statin treatment.
Professor Konstantinos Koshiaris, assistant professor of medical statistics at the University of Nicosia Medical School and a senior author of the study, said, quote, clinical decisions are often based on estimates of potential benefit, but understanding potential harms is equally important. This model provides a way to quantify that risk at an individual level, helping support more balanced discussion about treatment options.
So potential harms, that's side effects, right?
Yeah, side effects, yeah.
Yeah, and if
Negative side effects.
Yeah, and if you listen to some of those side effects, I don't know if sometimes that they're worse than the.
I know.
Either you're
It's
being
like,
treated.
what? Why am I taking this?
Exactly. By estimating your risk for each individual rather than relying on population averages, the researchers hope that calculator will help patients and clinicians make more confident, personalized decisions about statin treatment and cardiovascular disease prevention.
Okay, you've been waiting for it. Where is this calculator? The online tool called the Stratify Statin MD Risk Calculator, you can Google that, is available through the Oxford University Innovation Software Store for academic use. Us common folk can't use it because we're not academics.
Yeah, the difference between the haves and the have-nots.
That's right.
So what are you going to do here?
So when you're talking to your doctor, say, let's try the academic Statin MD whatever and
risk calculator
and take the 10 minutes to do it.
Yeah, what was that machine that Willy Wonka had? He spun the little
discombobulator.
Yeah, there you go. I don't know. It sounds pretty good. I mean, again, I don't go to the doctor that often, probably not as often as I should, but I know when I do go to the doctor, usually the first line of treatment that they want to give me is some kind of pharmaceutical.
Right. And the VA for sure.
Yeah, that's their deal. And I don't know. I mean, I'm just not really big on putting a bunch of stuff in my body. And anyway, it's a risk, I guess, but there again, we were just talking about the side effects, and I don't know. I'd rather have the disease, I think, sometimes. But statins work for people, though. They do. I know people that have, had some issues, and they've taken statins, and it's helped them. It's prolonged their life, which is what it's all about, right? So, I don't know. Mixed feelings.
All right, folks. Thanks for joining us. We'll catch you tomorrow.
Take care, everyone. Have a great afternoon, and we'll see you tomorrow.